Hi there, this is Dr. Khan. I made this video to just kind of make you aware and introduce you to some of the choices you have with the allergy treatment should you be positive based on your testing results. So this is a little bit of an overview. I'll give you a little bit more detail when I speak to you about your results, but this will give you a good idea of what kind of allergy treatment is out there. So the best way to think about allergy treatment is that allergy treatment comes in three levels: level 1, level 2, level 3. Level 1 is really basic. There are no medications involved. It just really involves what you can do to avoid the things that you're allergic to. So these are all lifestyle changes. It's very conservative management. Again, there are no medications involved. I will actually give you a handout on this, and just to give you a little bit of an idea, should you be positive to any pollens, so pollen comes from trees, grasses, and weeds, and if that's what shows up on your test, then we would basically tell you to avoid being around pollen. So tips here would include, checking the pollen counts every day. There are good websites to look at the pollen counts, and you want to kind of see what the overall pollen count level is. Is it low for that day, medium, high, very high? If it's medium or above and you're allergic to pollen, then those are the days you want to limit your outdoor time, including closing the windows in your house, closing the windows in your car. And then when you come home, and you know you're in for the day, you want to remove the clothing that you're wearing and put them in the washing machine as soon as possible, because pollen sticks to your clothes, your skin, your hair, even the mucus in your nose. So by removing the clothing, you're decreasing your exposure and you're not spreading it around the house, because every time you're walking around, that pollen gets, kind of put on the floor. It's dropping off of you onto the floor, and you're just going to come back by later and get re-exposed. So that's the reason you want to remove the clothing. And then you want to jump in the shower, because then you want to wash the pollen off of your skin, wash it off of your hair. You could even do a nasal saline rinse. So this would be something like a neti pot or Neomed, and it's basically distilled water, salt, and baking soda in a bottle, and you rinse your nose out with it. Now, if you haven't done this before, basically this would be you putting your head over the sink, or you can do this while you're taking a shower. You would put the nozzle of the bottle into the upper nostril and squeeze very gently, and it actually comes out the other side. I know that's a little strange, but when it does that, it's literally rinsing out the mucus in your nose that has caught all this pollen and other particles that you're allergic to. So after one squeeze, you turn your head the other way and do another squeeze on the other side. It comes out here, and you kind of go back and forth until this bottle is completely gone. And again, this is literally rinsing out your nose. A lot of people have a benefit from this, and I have a few patients that this is really all they do, and they get a tremendous amount of symptom relief. Now, this may not be true for you, but it can be part of your regimen. So remember here that the nasal rinse is really technically not a medicine, because it's just distilled water, salt, and baking soda. You do want to make sure you're using clean water. Don't use tap water. You can use bottled water for this solution when you mix it up. All right, so that's a little bit of an overview of pollen avoidance. And remember, again, we're still in level 1, which is lifestyle changes and conservative management. Again, I will give you a handout on this, so you'll have this in more detail. Now, let's say you're allergic to dust mite. Dust mite allergies are the #1 indoor allergy. And dust mites are little bitty insects that actually live in our mattresses, our pillows, sofas, chairs, carpet, draperies, anything fabricy. They like to nestle in there. So at night when you're sleeping, this is very disgusting, but they come out at night to feed, and they eat the skin cells that we shed every day. So we're their food source. They're not really on us, but they're around us. So basically, the best thing to do for dust mite avoidance is to buy some dust mite proof mattress and pillow covers. And there are two really good companies that we recommend that make the best covers. They use a particular material that can be woven together very, very tightly. so tightly that when you put the covers on, you actually prevent the dust mites from coming through that and getting to you when you're sleeping at night. And again, they're not on you, but they're around you. So basically, you would order these, get them in the mail. They last a few years after you get them, so it's like an investment. You get them in the mail, you go to your bedroom, you strip your mattress and pillow bare, you put the covers on, you zip them up, seal it, and then you can put some new covers, sheets, mattress cover, pillowcases on top of that. Again, now when you're asleep at night, the weave is so tight in this material that the dust mites can't get through. So that's going to be the most important recommendation as far as level 1 allergy recommendation for dust mite allergy. Other things are you really shouldn't be doing any of the vacuuming or dusting in the house if you can help it, because when you do that, it kicks up all the dust and then you're just breathing it in, and that's not good for you. So if you have to do it, the best thing would be for you to wear a face mask and goggles. I know that sounds funny, but that protects your airway. And then right after you're done, you take your gear off and leave the house for at least 1 or 2 hours to allow the dust to settle back down. Of course, ideally, if you can get someone else in the house to do it that's not allergic to dust mites, that's going to be your best bet. All right, long-term things for dust mite, and again, this will all be on the handout that I give you. Long-term would be, if you can in time, replace your den and living room furniture with leather. This is harder for dust mites to live in, and get rid of all your carpet. All right, next on the list would be furry pets. So if you're allergic to cats or dogs, this is kind of this category. I'm not going to tell you to get rid of your cat and your dog because that's part of the family for most people. But we don't really have a whole lot of great recommendation for this. The best that we can recommend is try to clean your pet at least once a week, so a bathing once a week, and then make sure your pet's not sleeping in the same bedroom as you are. And that's really the extent of it. There's not a whole lot of great scientific evidence beyond that. All right, finally, well, not finally, the next thing is if you happen to have an allergy to cockroach. So the best thing you can do is keep them out of your house, which most of us do anyway, naturally. And then mold allergy, the best thing to do is to keep your house clean. So that's basically all of level 1, a little summary, if in case you're allergic to any of the things that we just talked about. Level